My name is Dr. Valentine. I'm a medical officer working with Southern Shore Hospital, VGC. Cardiac arrest basically is a heart arrest, right? So what this means is when you have a complete stoppage of your heart activity due to some reasons. So that's what we call cardiac arrest. Your heart stops functioning. Usually some people complain about having chest pain. Usually comes up as sudden chest pain or sudden difficulty in breathing. Find people grabbing and holding their chest, complaining about severe pain. When someone comes in that state, we usually term it as cardiac arrest. So there are electrical activities that go on in the heart normally. Right, so there are things that could stop these electrical activities from functioning how they should happen. So like age, diet perhaps, lifestyle. So some people that do not exercise as regularly as they should can lead to a cardiac arrest, and some underlying conditions too as well, like diabetes, hypertension. So all this can lead to a cardiac arrest. Yes, so apart from the chest pain, which is usually excruciating, you have difficulty in breathing, like I said earlier. Some people complain of having nausea before they have that cardiac arrest. Some people complain of having pain not only in their chest, but also pain that moves to their arm too as well and underneath their jaw. So these are some warning signs. Some people come in sweaty too as well. Sweating, having palpitations, that they can hear their heartbeat in their head. All right, so all these are warning signs that can tell us that someone might be having a cardiac arrest. Age is a factor. So the older you become, your immunity gets weaker, your blood vessels become weaker too as well. So it might predispose you to having conditions like this, the cardiac arrest. Other factors include things like smoking, alcohol, so basically your lifestyle, your diet, not exercising properly too as well. They can all lead to having a cardiac arrest. Yes, they're usually confused. A cardiac arrest is when you have a sudden stoppage of your heart activity, while a heart attack might be ongoing for a long time. You have there are vessels that supply the heart normally. If you have a particular vessel supplying one part of the heart not functioning well, blood is not passing through that vessel as it should. Vessels supply blood to the heart, and this blood contains oxygen and nutrients. Imagine if these vessels are cut off. Okay, that means there's no supply of oxygen and nutrients to the heart. Now, when this is ongoing for a long period of time, the person might start to develop a heart attack. Whereas in a cardiac arrest, it is abrupt, a sudden stoppage of your heart activity. Breathing too, the person might become unconscious too as well. Okay, when you start to develop those symptoms that I told you about earlier, when you have the chest pain, when you have the difficulty in breathing, all those signs, that's when you need to call your doctor. And then you probably have some tests done, and then treatment will follow.
Swift Dry Cleaners Limited, professional dry cleaners, best in dry cleaning and laundry services, and meets the needs of our consumers. Yeah, Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. Yeah, for clean wash and quick delivery. Yeah, Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. For clean wash and quick delivery.
Swift Dry Cleaners. Clean wash, quick delivery.
So it's very important that they get to the hospital eventually. But if they are not in the hospital, of course, you can start some first aid treatment. So there's something we call Cardiopulmonary Resuscitation, where we manually take the function, as in replace the function of the heart manually. Rather than having the heart do it itself, we help the heart pump blood to other parts of the body by compressing on the chest and then also giving breath to rescue breath to the patient. By chest compression, what I mean is by applying pressure with your hands. Whoever the person, the rescuer is, be it a doctor or a passerby, anybody can do it actually. So you use your arms, your hands, press on the chest about 30 times. You're trying to massage the heart, pump the heart manually, and then give 2 rescue breaths from your mouth to the other person's mouth too as well. So with this, you should be able to rescue the person. So you continue to do this till you get help, or you can get the person to the hospital. Yeah, so that is the first aid treatment you give to someone who is experiencing a heart attack or a cardiac arrest. So prevention, first of all, you need to know what the underlying issue is. Some people have underlying issues like maybe kidney issues or hypertension, for instance. All this can lead to having a heart attack. You can prevent it by watching your blood pressure, okay, taking your antihypertensive medication if you're placed on it. Other things that can cause it is your diet. Some people take a lot of cholesterol, fat in their diet, and this fat tends to block vessels too, and thereby leading to a heart attack. So you watch your diet too as well. Reduce your fat intake, cholesterol intake too. Apart from that, smoking, alcohol, and exercising too as well. If you can, quit smoking, reduce your alcohol intake to a minimal level, and also exercise appropriately, adequately. You should be able to prevent a heart attack from occurring. When we say exercise, we don't mean like vigorous exercising. WHO recommends that you have at least 30 minutes of minimum moderate exercise at least 5 days in a week. So 30 minutes of moderate exercise on at least 5 days a week, not excessive exercise as footballers. So taking a long walk, perhaps brisk walking too as well. So the treatment plan for patient with cardiac arrest is usually, if you can't resuscitate the patient immediately, then you would have to consider surgical procedures. So there are things that you can do, like maybe change the pacemaker of the heart, okay, to enable the heart start beating on its own again. But all this will be done surgically. But we'll rather prevent it before it gets to that point. But anything from when you have the heart attack and you come into the hospital or a cardiac arrest, anything from that, you would have to help the person surgically.
iBrandTV. Business first.